The recurrent dislocation of patella. So this recurrent dislocation is most of the time is seen in girls, especially young girls. So first dislocation occurs during the adolescence, but with the time the frequency increases. As the girl ages, the frequency of this dislocation increases. That's why the recurrent dislocation of patella. So occur often when the knees is straightened from the flexed or the semi-flexed position. Patients show generalized congenital laxity, which results into this kind of dislocation. Now let's see the pathology. First episode of traumatic dislocations, once it is done, there is a tearing of the capsule on the medial side of the patella. Now if this tearing is not healed properly, it will result into the persistent laxity in that area. Now this laxity will result into recurrent dislocation. Now due to the recurrent dislocation, there is a damage to the contiguous surfaces of the patella and the femoral condyle, which will result into the flattening as there is a recurrent dislocation and the surfaces are getting damaged. So there is a flattening and further dislocation. So this keep on increasing with time. Now there are certain abnormalities that contribute to the recurrent dislocation. The first is the shallow intercondylar groove. So normally we have this kind of groove, intercondylar groove, where patella sits. But sometimes this groove is shallow, or if there is a underdeveloped lateral condyle, this will result into the recurrent dislocation of patella. Next is small size patella. Usually we have a specific size of patella, but if the size of patella is small, that will also contribute to the recurrent dislocation of patella. Excessive joint laxity, especially on the medial side. Next is high-lying patella, which is known as the patella alta. This is a normal condition. Patella usually sits on the femoral condyle. Sometimes it is patella baja, where the patella is inferior lying, and sometimes there is a patella alta, which is a high-lying patella. So in high-lying patella, in patella alta, there are chances of recurrent dislocation. Other condition, other abnormality is the genu valgum. In genu valgum, the line of pull of quadriceps shifts laterally. So it will pull the patella laterally whenever there is a contraction of the quadriceps. This will also result into the recurrent dislocation of patella. So what is the treatment? Treatment is consist of operative reconstruction. Now in this reconstruction, what happened? The insertion of the patellar tendon, this patellar tendon on the tibia reciprocity is shifted medially and downward. This is a original place and it will shift here on the medial side and downward. So the line of pull of the quadriceps shifts medially. So this will not allow the patella to dislocate laterally when there is a contraction of the quadriceps. This operation is known as the Hosser's operation. Now there are some current trends. Now according to the current trends, it is important to find the cause of the recurrent dislocation of patella and correct the cause. So the cause could be any, like we have already discussed, genu valgum, increased QR angle, there may be laxity of the structures, especially the medial patellofemoral ligament. So we need to correct the cause instead of correcting the problem. Corrective surgery should be aimed at correcting the underlying cause, which could be any, like increased QR angle, genu valgum, or joint laxity, or patella alta. It could be any. And the operation are usually done arthroscopically assisted. Now this is the mediopatellofemoral ligament reconstruction. As we see, patella dislocates laterally, sometimes due to the laxity of the structures on the medial side. So we need to reconstruct the medial patellofemoral ligament, as this is a major ligament, because it stabilizes the patella and prevents the patella from sliding out of the groove. So this is how it is reconstructed. I hope you like the video. In case if you like the video, do like, share and subscribe the channel.